آسف على التأخير، أكو بعض المشاغل كانت موجودة. اليوم محاضرتنا عن بكتيريا المايكروبكتيريوم. Mycobacterium is very important medical bacteria, causes a wide range of infection and causes life-threatening disease. This bacteria presence in environment in soil and water. This characterized by grow slowly, acid-fast bacteria. Because of this bacteria has a high lipid content in their cell wall. Have a mycolic acids. This material or substance is unique for the mycobacteria and related organisms such as nocardia. Various factors, including complex lipid-rich cell wall that is responsible for virulence and pathogenesis of this bacteria, and is responsible of many properties such as acid fastness, slow growing, resistant to detergents, resistant to common antibacterial agents, and antigenicity. Mycobacterium tuberculosis is leading to or causative agent of tuberculosis. Infection is acquired by inhalation of infectious particles, which then travel to the terminal airway. At the site of the infection, the bacteria penetrate into an activated alveolar macrophage, phagocytosed, and prevent diffusion of phagosome and lysosome. This will prevent phagosome lysosome vein and replicate freely. So this bacteria unable to go in activated macrophage. Macrophage can be activated by gamma interferon that is produced by many types of cells such as CD4 plus, dendritic cells, cytotoxic T cells, and gamma sigma T cells. Organism then elicits cell-mediated immune response in immune-competent patient, which help in the controlling of infection. And when the bacteria is replicate, stimulate both helper CD4 and cytotoxic CD8 T cell to form granuloma. This figure illustrates the mechanism of activation and pathogenesis of bacteria when the macrophage with pink color is phagocytosed bacteria activated by gamma interferon that is produced by T helper 1, CD4, and by CD8 to form or degraded the bacteria and form granuloma. Various factors of this bacteria organism able to replicate in non-activated macrophage can survive for years in dormant state. Pathology depending on the host response to infection rather than abuse of bacterial toxin or enzyme. There is no toxin associated, but immune response is initiated and stimulated by cell wall of bacteria that containing high lipid content. Production of tumor necrosis factor alpha, interleukin 1, and interleukin 6. This is inflammatory cytokine responsible for pathogenesis and pathology and destruction of tissue during the course of infection. Disease can come on suddenly with patient having a specific component of malaise, weight loss, cough, and night sweat. Constituent of tubercle bacilli, mycobacterial cell wall only elicit delayed type hypersensitivity reaction. This means type 4 of hypersensitivity. Constituent including lipids is very important in case of mycobacteria, including mycolic acid, waxes, and phosphatids. And the cells, the lipids are largely bound to protein and polysaccharide, and in some extent responsible for acid fastness. For protein, each type of Mycobacteria have several proteins that elicit the tuberculin reaction, tuberculin test, when the patient injected with protein, Mycobacterial protein. This elicits the light type hypersensitivity and help in the diagnosis of infection and immune response of patient against bacteria. Protein bound to axis fraction can, upon injection, induce tuberculin sensitivity, such as purified protein derivatives. They can also elicit the formation of variety of antibodies. Antibodies, in case of Mycobacteria, have a less role in the defense against this bacteria, while the main role is attributed to the cell-mediated immune response. Polysaccharide, also this bacteria have a variety of polysaccharide. Their role in pathogenesis of disease is uncertain or unclear, and they can induce the immediate type of hypersensitivity, type 1 hypersensitivity, and can serve as antigen in reaction with sera of infected person. The second most important species in Mycobacterial group is Mycobacterium leprae, that causes leprosy, also called Hansen's disease. Endemic disease found in armadillos, spread by person-to-person contact by inhalation of the infectious aerosols or direct contact with lesion. Clinical manifestation depending on immune reaction between host and bacilli. يعني الملاحظ انه في اصابات المايكوبكتيريا دائما تكون لها علاقه وثيقه بالحاله المناعيه للمريض في جميع انواع هذه البكتيريا. Leprosy can be divided into two main types, and we usually must be now how can be differentiated between two types. The first type is tuberculoid leprosy with low infectivity, strong cellular immune response, but a weak humoral antibody response. This is very important feature. Infect tissue typically have many lymphocytes and granuloma, but relatively few bacilli because of the elicitation of cell-mediated immune response. The immunity is control the infection, and in the granuloma we seen a few number of bacilli. While lepramatous leprosy, characterized by most infectious form, strong antibody response, but a specific defect in their cell immunity, cellular immunity to Mycobacterium leprae antigen, and abundance of bacilli are typically observed in dermal macrophage and the Schwann cells of peripheral nerves. Leprosy is the only disease that can be seen two type of or two branch of acquired immunity. In case of tuberculosis, the predominant is cellular immune response and help in control infection and downregulation of humoral immune response. So we see large number of lymphocytes and a few number of bacilli. But in lepramatous leprosy, the predominant form of acquired immunity is antibody immune response with downregulation of cellular immune response. So the lesion has a large number of bacilli with a few number of lymphocytes and high antibody concentration. ضروري طلاب انه تحفظون يعني او يعني تفهمون الفرق بين التيوبركلويد ليبراسي والليبرماتوس ليبراسي وال causes of this and consequence of this differences.
دكتور عذرا عن المقاطعة، بس المحاضرة على أول سلايد.
ليش أنا جاي قدامي جاي تنتقل من سلايد إلى آخر؟
لا ماكو دكتور، لحد الآن الطلاب كلها جاي هيك.
يعني جاي هاي هاي حد. هسه جاي تتغير؟
لا ماكو لحد الآن.
ماشي، هسه بس أتأكد لك. Other types of Mycobacterium is Mycobacterium avium complex. It's composed from Mycobacterium avium and intracellularly. In fact, the gut found in AIDS patients, which means immune-compromised patient, acquired through ingestion of contaminated food or water. Lab diagnosis of mycobacterial disease, including the skin taste, purified protein derivative is injected subcutaneously. If the person was exposed, formerly it will swell. After positive test, use chest X-ray to look the lesion and other tests. Acid fastness or acid fast stain, also called Thiel-Munson stain, this used for staining of sebutums and material from patient. This composed from basic stain is a carboyfoxine and then decolorized by acid alcohol and stained with counter stain methylene blue. شباب الملاحظ هنا انه اي بكتيريا اذا صبغناها بالكربونفوكسين واستخدمنا الاسيد الكحول راح يتم ازاله الصبغه من البكتيريا. فلما نصبغ بالميثيلين بلو راح تظهر عندنا البكتيريا زرقاء اللون. في حاله المايكوبكتيريوم this bacteria is resistant to acid alcohol decolorization, so the bacteria appear pink according to the color of carbofoxine. And this method is very important method in the diagnosis of mycobacterial infection. Now, culture the media for primary culture of mycobacteria should include non-selective media and a selective media. As now, selective media has inhibitors such as antibiotics to prevent the overgrowth of contaminated bacteria and antifungal for prevent the growth of fungi. There are three general formulations that can be used for both the non-selective and selective media. The first is semi-synthetic agar media. These media, including Middlebrook 7H10 and 7H11, contain defined salt, vitamin, cofactor, oleic acid, albumin, catalase, glycerol, glucose, and malachite green. The 7H11 medium contain casein hydrolysate. Also, these media may be less sensitive than other media for primary isolation of mycobacterium. دائما نلاحظ الآن بالفورمولا الموجودة this formula containing a high lipid content. The semi-synthetic agar media are used for observation of colony morphology for susceptibility testing and with added of antibiotics as a selective media. Also, unspiscated egg media. This media is Lowenstein-Johnson. Lowenstein-Johnson media is widely used throughout the world. Contain defined salts, glycerol, and complex organic substances such as fresh egg or egg yolk, potato flour, and other ingredients in various combinations. Malachite green is also included to inhibit the growth of other bacteria. Small inoculant specimen from patient will go on this media in 3 to 6 weeks. This media with added antibiotics are used as selective media. طبعا شباب الان الكلتشر تقريبا استخدامه يكون قليل، اقل من الطرق الباقيه اللي هي الزين نيلسون، وهسه راح نجي للطرق الاخرى اللي هي موليكيولار تكنيك. Growth media including Middlebrook 7H9 and 7H11 support the proliferation of small inocular growth is often more rapid than the complex media. شباب question هذا تعتبروه كهوم وورك تقدرون تدزونه على الجروب. جاي تسمعونه شباب؟
نعم دكتور واضح الصوت.
Mycobacterium is a slow growth because of خلي مو هوم وورك بعدين نسوي لكم فد امتحان. Mycobacterium is a slow growth because of شنو السبب هنا بهاي الحالة؟ شباب ممكن إجابة؟ ما أخذتوها بالبكتيريا الفسيولوجي عند growth؟ This occurs due to the generation time of Mycobacteria is about 13 hours. This means 1 cells of Mycobacteria become 2 in favorable condition in 13 hours. When compared with E. coli or doubling time of E. coli is 20 minutes. So E. coli require 18 to 24 hours to produce the visible growth on culture media, while Mycobacteria require for 3 to 6 weeks to produce visible growth depending on the amount of bacteria in inoculum. يعني احنا سبب هذه الحاله انه مثلا المايكروبكتيريوم tuberculosis بالكلتشر نحتاج 3 إلى 6 أسابيع. The generation time of this bacteria is or doubling time is 13 hours 13 ساعه، بينما الايكولاي 20 دقيقه. فبالايكولاي نحصل النمو خلال 18 الى 24 ساعه. Also, Mycobacteria tend to be more resistant to chemical agents than other bacteria because of the hydrophobic nature of the cell surface due to the presence of high lipid content and their clumped growth. Dyes such as malachite green can be incorporated into media without inhibiting the growth of tubercle bacilli. Acids and alkaline substances permit the survival of some exposed tubercle bacilli. These bacilli are resistant to drying and survive for long periods in dried spot, sputum. Pathology, the production and development of lesions and their healing or progression are determined chiefly by the number of mycobacteria in the inoculum and their subsequent multiplication, and the resistance and the hypersensitivity of host. This is very important factors, and the most important is the resistance or the immunity of the host against bacteria. There are 2 types of lesion, including exudate type. This consists of an acute inflammatory reaction with edema fluid, polymorphonuclear leukocyte, and later monocyte around the tubercle bacilli. This type is seen particularly in lung tissue where it resembles bacterial pneumonia. This is a first or beginning of granuloma formation. The second type is a protective type. When fully developed, this lesion is converted. A chronic granuloma consists of 3 zones. The central zone or area of large multinucleated giant cells containing tubercle bacilli in dormant state. A mid-zone of pale epithelioid cells often arranged rarely, and a peripheral zone of fibroblast, lymphocyte, and monocyte that surrounded this bacteria. Later, peripheral fibrous tissue developed and central area undergoes caseation. In necrosis, such lesion is called a tubercle or granuloma. This is very important feature of this bacteria, is a granuloma formation. This occurs in patients with good immune response and the presence of cell-mediated immune response that help in controlling of infection. But when the immune response is shifting from cellular immune response to humoral immune response due to many factors such as infection with encapsulated bacteria or extracellular bacteria, or due to some vaccines, this lead to opening of granuloma or tubercle and remove of liquid and separate of bacilli to other or adjacent tissue. Treatment: chemoprophylaxis, 6 months with isoniazid, rifampin, pyrazinamide, ethambutol, or streptomycin. This is called first-line drugs for treatment of TB. Thank you. شباب اكو سؤال؟ شباب؟ شباب اكو سؤال؟
دكتور العفو، بالنسبة للهوم وورك اللي انطيتنا بالمحاضرة اللي سبقت كان سؤالين على الكلوستريديا كهوم وورك. وين نسلمهن؟ يعني ندسهن بالكلاس لو شنو؟
ايه بالكلاس. لو تريدون اعطيكم الجيميل مالتي كيفكم؟
دكتور كون سوينا فورمة افضل يعني ندس بها جواب.
ماشي اوكي، اسوي لكم فورمه وندزها لكم ودزها.
نعم دكتور.
الشغله هاي كلش بسيطه، ماكو مشكله ان شاء الله. زين. بعد استاذ حسين عندكم بعد فد شيء طلابنا؟ حتى بعدين
دكتور سلامتك.
الجاي راح نكمل المحاضره ان شاء الله. شنو اللي واصلكم من المحاضرات؟
ان شاء
الله. الوورد
كلهن تقريبا كلهن وصلن، هي بس محاضرة اليوم ما وصلت، عندنا ما بعدين.
قصدي كوورد مو كباوربوينت.
كلهن وصلن دكتور.
وصلن وورد؟
نعم دكتور.
ماشي، انا مع ذلك على كلاس راح انزل لكم المحاضرات مالت الوورد. شنو المحاضرات هسه اللي عندكم انتم؟ كلوستريديوم؟
نعم دكتور، افضل كنت نزلها على الكلاس بعد افضل، يعني كل يوم بيوم افضل.
اوكي، هسه شنو عندكم انتم المحاضرات؟ المايكروبكتيريوم مالت اليوم؟
نعم دكتور.
والكلوستريديوم، وبعد شنو المحاضرات اللي الاخرى حتى كلهم انزلهم حتى السابقه مالت الكورس الاول؟ صح
اخذنا نعم دكتور، احنا بالكورس الثاني اخذنا الباسيلاس واخذنا الكلوستريديوم واخذنا اليوم محاضرة اليوم مايكروبكتيريوم.
ماشي اوكي، ان شاء الله ان شاء الله.
نعم دكتور.
شكرا جزيلا. اكو سؤال؟